Hello everyone, this is Dr. Rituparna Ghosh, Consultant Clinical Psychologist, Apollo Hospitals, Navi, Mumbai. Today I am here to discuss a very important topic related to the area of oncology. Yes, the role of mental health care in cancer patients. We all know that once cancer invades the life of a person, it not only affects their physiological makeup, but at the same time, it adversely and tremendously affects their psychological, social, and emotional wellness. Hence, a multidisciplinary approach is needed to work on the psychosocial well-being of the person along with the physical health issues. So we all know that once a person is diagnosed with cancer, there are so many questions that keep on coming in their minds. Sometimes they do express and sometimes they are unable to do so, and they keep on internalizing that stress that keeps on adding up to the already existing illness. There can be so many questions. Will this diagnosis affect my personal life? Will I be able to work like earlier? Will I be able to take care of my family like earlier? Even post-recovery, will the cancer come back again? So there are so many questions that keep on invading the person's mind. So the nature or the requirement of psychotherapeutic intervention is a must during this phase of treatment, because it helps the person to take care of his or her mind along with the treatment protocols. The therapeutic interventions teach the person how to deal with the intense anxiety and depression that they go through. Also, the unpredictable course of the illness, delayed diagnosis, constant fear of survival add on to the mental health distress. The therapy interventions focus on ways to deal with your own body and mind, and at the same time, how to deal with the intense emotions and how to establish good interpersonal relationships and help and enhances in proper adjustment during the course of the entire illness. So why this counseling is needed? It helps a lot in helping the person to deal with the body image issues that many often we see among cancer patients. They have a lot of body image issues related to their appearance post-chemotherapy. They have a fear always that something might happen to me anytime. So these fears, at the same time, the fear how to deal with the pain and the fatigue. Also, how will people judge me? How will I accept myself as a person now? How the entire world is going to change for me? These questions that they continuously battle with, therapy helps them to give the answers and to show them positivity in their life to live happily. There are several stages the way therapy is conducted. The first is to provide support, to give the person the room to talk about their intense negative emotions, to listen to them. Then comes the basic coping strategies, focusing on ways to deal with stress, citing the person's stress management skills. Then comes the advanced coping strategies, wherein therapy helps to teach the person to accept the way they are and to work on their self-esteem. And then comes the part wherein they are helped to see life in a positive way, to live one day at a time. Continuous instilling of hope, to see the brighter aspect of life, to start living every day is what we teach in therapy to the person. Even the role of therapy is utmost important in palliative care, where we help the patient to maintain that hope for living, to help process the negative emotions in a much more productive manner, to look towards life in a brighter aspect, to deal with these emotions and to help them how they need to deal with the environment after they get diagnosed with this disease, and also to help them to keep on instilling hope in their lives. This is very important, because we all know that cancer, the term itself, is dreadful enough for the person to let that person, keep on getting deep embedded with the fear of survival. And that's something we need to work upon. As psychologists, as mental health professionals, we need to teach the person how to live life in a brighter aspect. So counseling and therapy and the role of mental health care is very, very important in cancer patients. We all know the word cancer has a can in it and we can deal with it. So taking care of our mental and psychological well-being is very important in changing the cancer landscape. Thank you.